Now we'll try to do some sample questions, because why not, and apply the heuristics that we talked about. So this is going to be an example where we'll have a long stem and we'll have a single anchor, and we're going to look at the pathognomic sign. So what do? Let's start with the last option, and I'm going to use the only this is going to be the only time that I'll use a pen on this presentation. First thing, what is the most likely diagnosis? So they are going to ask us about diagnosis. Good, right? So now before I go to anything else, I'll just like try to look around and be like, are there any pathognomic signs? What is it that I feel is pathognomic? So maybe this line: episode lasts 15 to 20 minutes and resolves, and there is high BP. Now episodic, my mind is going to episodic stuff. What is episodic in all of this? I can easily say that essential hypertension is is a continuous process. It will not have a person's BP being continuous, like it will have a person's BP being continuously high. It will not be episodic, and it will not resolve like spontaneously. You need to give some medication. About panic disorder does happen, but it does not involve periods being like the time period being like 15 to 20 minutes, and the BP doesn't go that high, because they are more psychogenic in nature, right? So I'm not thinking this. Now even hyperthyroidism, even if we think about hyperthyroidism, right, like hyperthyroidism, what I can think about is, for example, like myxedema or something like that. Even during that, there is no episodic stuff. So just based on this one fact, there's nothing episodic, I can be like, okay, option C is the correct answer. Let us see if that is the correct answer. I say as I already know the correct answer, what the correct answer is, because I prepared the PPT, the presentation. Yeah, yippee! Yeah, we are right. The option C, pheochromocytoma, is the correct one. Moving on to the next one, example number 2: numericals, extremes, and guideline logic. Now we look at this question. So this is a relatively shorter question, and for this, you don't need to like look at you don't need to figure out exactly like key clue points, like, because I'll just read out the question. A drug reduces heart rate by blocking beta blockers, right? Which of the following heart rates is most likely after administering the drug? So there are 4 options. Option A, 30 beats per minute. Option B, 45 beats per minute. Option C, 60 beats per minute. And option D, 120 beats per minute. Now imagine that I don't know what beta blockers are, right? But here the question they've given that the heart rate is reduced. So as we talked about the numerical heuristics before, we'll think that, okay, the highest option and the extremes are bad, so option A and D, we are removing them. Now we'll look at 2 things. There's option B, which is 45 beats per minute. Option C, 60 beats per minute. Now I can remember somewhat that if my heart rate goes below 60, that is bradycardia. If it goes below 100, that's tachycardia. So I can remember something. So let me put C as the correct option. Let us check. And C is the correct option, ladies and gentlemen. Moving on to the next example. Example number 3: paired distractors, absolute and option length. Now which one of the following statements about antibiotics is true? Option A, antibiotics are always required for fever. Option B, antibiotics never cause adverse effect. Option C, antibiotics may cause side effects and should be used when indicated. Option D, all infections require antibiotic therapy. Now we are going to look at it from a scientific skeptical perspective, right? Like we are a skeptic. So as we talked earlier, right, science always talks about things in specifics. Science is always sorry, again, I'm using the same error. Science usually never has like complete conditions. For example, the first option, antibiotics are always required. No, I'm not saying that, because I know that antibiotics are not always required, but always and never, these are unlikely to be true. Second, antibiotics can never cause side effects. Never, no, because there are exceptions to things, right? Now option D, all infections require. All infections, no. So I can think that even if I don't know what antibiotics do, I can be like, okay, option C, which says antibiotics may cause, there is like a may, there is like a clause there. So C is going to be most likely the correct option, and it turns out yes, it is the correct option. Short absolute statements are easy to write and easy to make wrong. So your correct answer is going to be longer. It is going to be not so absolute. It is going to be the correct answer. Now example number 4, umbrella versus specific. And here we are going to talk about the examiner's intent. A patient with bacterial pneumonia a patient with bacterial pneumonia presents to the emergency department. What is the next best step in the management? Okay, we have 4 options. Option A, start antibiotic therapy. Option B, treat infection. Option C, improve immunity. And option D, underlying condition. So firstly, we'll read the we were supposed to read the last line, which is what is the next best step in management. So here what I want you to understand is you have to like use the method where we obviously eliminate the worst option. So as we were talking, right, person is has presented to the emergency department. We can't we can't do anything to erase sorry, wait a second, let me just erase this on the screen. I think I can do it. I don't know how to. Okay. Oh, wonderful, lovely. I erased it. So person presents to the emergency department, right? We can't ask him to improve his immunity in the moment. It's like an unnecessary thing to ask to someone, right? It's like someone had a car accident and they're like laying there on the road, and you go up to them and you're like, you should have been more careful while driving. You can't do that. So option C, no, we are thinking it's not the correct answer. Wrong. I hate you, option C. And then option D, manage underlying condition. What underlying condition are we managing? We just have been given bacterial pneumonia, so no, this is stupid option. And then we have 2 options. This is where our umbrella thing comes up to be. Option A is start appropriate antibiotics, and option B is treat the infection. Of course, the patient wants us to treat the infection, but how do we treat the infection? We treat the infection by using the appropriate antibiotics. So that is how we select this option, because it's not in the umbrella term. Next, so option A is the correct option. Start antibiotics, the appropriate antibiotics. When the question is specific, the answer must be specific. Example number 5, WTF question and our educated guess. A rare condition present with symptom X and lab findings Y. Which of the following is the most appropriate steps? Option A, aggressive treatment. Option B, conservative treatment. Option C, experimental surgery therapy. And option D, intervention. Now we have to pick an option where even if we do something right, we are not harming the patient more than we can. We are helping the patient, right? So we'll look at the conservative, the options which are like more easier. We'll not go for aggressive treatment. We'll not do a surgery on the patient. We'll not give him an experimentary therapy. We'll do conservative management, because maybe then some other doctor can look at the patient. So yeah, B is the correct option in this simulation. So when you are unsure, pick the safest reversible option.